Hello everyone, I am Dr. Mohana Preethi and I am a cornea and a phacosurgeon. Today I would like to discuss about cataract and its symptoms and what all precautions do we need to take regarding it. So coming to cataract, we have from front to back the cornea, the lens and the retina which helps in forming the image of any object. So the lens which is in the center of the eye is very clear. So when the light rays are focusing on the lens, it helps in giving a clear image over the retina and helps in forming a sharper image. What happens with aging is just like how our hair grays, in the same way, even the lens gets opacified. So it becomes more whitish in color as age passes by. Once the lens becomes opacified, the clarity of the image reduces. There will be short fall of vision and there will be a lot of glare and photophobia. That is, you would not be able to see the light. So usually this cataract occurs beyond 50 years. So whenever the lens gets opacified, which we say it is a cataract. Mostly age-related cataract is the predominant thing, that is prevalent. So above 50 years, everyone will be getting cataract. Some might get early, some might get delayed. Usually within 30 years, increased exposure to UV rays, especially in farmers and agricultural workers, will also give rise to cataract. Especially steroid usage. Some people might be using steroids for other diseases, other systemic diseases like rheumatoid arthritis or asthma. So because of the steroid drops, in long term, it can give rise to a cataract. Even allergic patients, patients with eye allergy are also prone to use steroid eye drops in the long run. When steroids are used in such long run, cataracts usually develop and it might need surgery at a later date. Children who have eye infections, who have diabetes, or who was prone to torch infections during their pregnancy are also prone to get cataract. Apart from this, whoever is having diabetes, they have an increased tendency to get cataract at an earlier stage, even before 50 years. Usually, cataract starts as age-related cataract. The name itself says age-related. So it occurs beyond 50 years, mostly because of aging changes. So once the aging starts, the lens clarity decreases. So just like how our hair grays off, even the lens gets gray. So in that manner, it starts above 50 years. Everyone beyond 50 years are prone to get cataract. Some people might get early, some people might get delayed. Above 50 years is the simplest age-related cataract. But keeping this apart, we can also have cataracts apart from 50 years within 30 to 40 years, either because of increased exposure to UV radiation or farmers who are working a lot in the fields under UV rays, they can also get cataract. Apart from this, there is congenital cataract, which occurs in children. So in children, when the mothers are pregnant, either when they are infected with particular infections or if the child itself is suffering from any systemic diseases, then the child also can get cataract. That is called congenital cataract. Apart from all this, we also have traumatic cataract, which means post-trauma to the eye. Any object that has damaged the eye can also result in touch of the lens and it can also lead to traumatic cataract. The main symptoms are glare. So the patient will not be able to see the light in front, or the patient will be having a lot of glare and photophobia. Photophobia, that means he is not able to see the light, even sunlight or even the headlights, especially during nighttime, it will be all the more a problem. He can even have colored halos. So he might be able to see color rings around the tube lights or certain lights. Apart from this, he can also have fall in vision slowly. If he is not getting treatment immediately, there might be total blindness. There is a term called congenital cataract. Congenital, that means the children can also get cataract. So usually it occurs, especially in nursing mothers or in mothers who are in pregnant mothers, when they are infected with toxoplasmosis, rubella, and CMV infections, then the child is prone to get cataract. Even AIDS and other infections can also give rise to this cataract. Apart from this, if the child is suffering from glaucoma or if he's using any eye drops which are not necessary, like steroid eye drops, then he can prone to get cataract. Even trauma, especially children are prone to playing with the pencils and the leads. The lead in the pencil can also give harm the eye and can cause cataract. So usually the children will be having a tendency to play with pens and pencils. Whenever they are getting injured with such objects, can also give rise to traumatic cataract in children. With regards to treatment of a cataract, the only option is surgical treatment. We do not have medical treatment available for cataract. So cataract surgery is mainly the removal of the opacified lens and implanting a lens, just like our spectacle glass, specialized customized lens according to the patient into the spacious area where we have removed the opacified lens. Because of this surgery, what happens is the distant vision gets improved. So the glare and all reduces, the defective vision is lost, and patient has increased clarity for distant vision. But the disadvantage is the near vision, we need glasses. So we need to wear spectacles even after cataract surgery is done. People usually we don't need to use glasses post cataract surgery, but it's not that thing. If we are implanting a type of lens called monofocal lens, then we need to use glasses even after the surgery. There is one more type of lenses, which is specialized lens called multifocal lenses. So in these lenses, you will have different types of rings that helps in both distant vision as well as near vision. So in such cases, you don't need to use glasses post cataract surgery. But this multifocal lens is not suitable in all cases, especially when you are an avid driver or an avid reader, or when in diabetics, especially who might need laser at a later date. These multifocal lenses are not a very good option because they can give rise to a bit of glare. But if one eye is implanted with monofocal lens, we cannot implant the other eye with a multifocal lens. We are mostly having to implant a monofocal lens in the other eye also. Right time to visit a doctor is either when you are having a fall of vision or when you are having glare that is increasing, especially during sunlight or during night vision when you're having glare around the headlights, or when you are having diabetes, or if you are at age above 50 years, every 6 months a visit to an eye doctor is mandatory. If your age is not beyond 50 years, either fall in vision or glare should be your symptoms to visit the doctor. Once the cataract surgery is done, the surgeon's part is over. Then comes the responsibility of the patient for at least 1 month to 6 weeks. For 6 weeks, he must use the eye drops in a proper manner that is prescribed by the eye doctor. He cannot tamper the usage of these eye drops in any manner. He has to use it in a tapering manner. So mostly the eye doctor will be prescribing steroid eye drops, which has to be reduced every week with 1 drop. So the usual regimen is mostly they'll be starting with 6 times a week, then 5, 4, 3, 2, 1. So total of 6 weeks, the eye drop has to be used. Apart from this, you should not sleep over the side where the surgery is done. So if your right eye surgery is done, then always try to sleep on the left side, not on the right side, at least for 1 month. Also avoid shampooing your hair and avoid oiling your hair, because any soap or shampoo or oil can harm the eye and it can lead to severe infections. And if at all within the 6 weeks regimen, if you are having any bit of redness, watering and any complaint as such, you should immediately check with your doctor.